routine is really how it works, and it depends on what ward you're on. So if you're on a surgical ward, it's very much around what's happening in the operating theatre that day. So you're allocated a certain number of patients, and you follow those patients through to prep them for surgery and get them. You're doing your observations, you're doing your medications. And you're sending them off to theatre, you're going up to recovery to bring them back down, and then you're monitoring them after they've had their operation. So it's very structured, and depending on whether it's a medical ward or whether it's a surgical ward, whether it's an oncology ward, you are looking at a structured job, and you support each other. So when someone goes off on a tea break, you cover their patients. And you really have to work as a team. It's a team environment. So you usually have a nursing sister who's in charge, who checks that everyone's managing to do all of their work. And then you're looking at, getting support to do medications. So it's quite a high responsibility when you've got Schedule 8 drugs. You need to be having them double checked. And you need to be very on your toes, because there are lots of accidents, so you do need to be double checking what you're doing. So you need your maths, you need to be able to calculate drugs, you need to be able to calculate drip rates. So maths is really important. You need to understand science, physics, lifting things and making sure you don't hurt yourself, making sure you don't hurt your client. So those two are really important, but I think the most important thing for all nurses is communication skills, and I think that's what nursing has always excelled at, is being able to communicate with everyone, whether they're old or young or disabled or able-minded. You need to be able to use your communication skills, and it is a big focus of the degree, is being able to talk to people and listen. So those sort of skills are really important, and you use those on a daily basis with your colleagues and with patients. But depending on where you work, there are different routines with different drugs. So there are, in paediatric wards, it's usually 2 people sign off on whatever drug's being given. You need to ensure that you have your prescription written correctly. There's lots of checking and double checking. There's checking of what the doctor's orders are. There's really, it's checking that those doctors who are way overtired and work that 48 hours, in the last 48 hours, so really long hours, and they've written their drug schedules properly, that they've ordered the correct drip, they've ordered the correct drug. So it's really, you're checking and double checking all of the time, so you need to be on top of that sort of thing. So it's challenging. I don't think nursing's a walk off. You couldn't just walk off the street and do it. You would have to have a good understanding of drugs and interactions and how they work in certain situations. But it's a lot more tricky than people think it is. I don't think people give nurses enough credit. It's not just about changing bedpans. It is much more about knowing the science behind something and knowing anatomy and physiology and how the body works. It's understanding drug reactions. You've got to have your chemistry. You've got to have the science background. Plus, you've got to have these skills to communicate with people.
You think you got the best of me? Think you've had the